Webinar on the heart. Very simple topic, but very important one. The heart is a major organ. We know what happens if the heart is not doing what it needs to do. That can be a problem. So good afternoon, welcome. If there's someone you still need to invite, send them a reminder. They should be on here to listen to this valuable information. Just say hello to us in the chat. Tell us where you're joining from. And we can see which countries, which part of the world are being represented this afternoon. Nobody's telling me where they're joining from. Okay. I know I can see someone from London. You're welcome. You're welcome. All right. Oh, hello from Istanbul. Awesome, in Turkey. You're very welcome, Izuchuku. Thanks for joining. Okay, before we go to our speaker, we have a short welcome message from the founder of Gintavenes Foundation. And so we'll just listen to that now.
Welcome
Webinar
to
on the
yet
heart.
another
Very
of our
simple
webinar,
topic, but very important one.
Today we have a very distinguished cardiologist who has practiced many years and is doing a lot of good work in Nigeria. He will be telling us all about the heart. I will not preempt his talk, but it will start with the physiology and the things that can go wrong with your heart. So basically, anybody that has a heart should be joining the meeting. If a lot of your relatives or friends haven't joined, send them the link and ask them to join so that we continue to inform people about what can go wrong, seeking help early that they may prevent serious illness or death. As usual, our intervention is based on public donations and all that. So if you're able to donate to help our cause, our able project manager, Mr. Johnny Sangbedo, will be giving you the details to donate so that we can continue to do more of this. Thank you very much for joining, and keep your eyes open for some of our other meetings. Thank you very much. I will now hand you back to our able moderator, Mrs. Flora Coker.
All right. Thank you very much, Dr. Agu, for the welcome. Where's my video gone? Once again, for those who've just joined, you're welcome to this webinar on the heart. We are going to go straight into it now. And I'm just going to introduce our speaker for this afternoon. I'm just going to read his bio. Dr. Johnson, I'm going to summarize it. Please don't be upset with me. So our speaker for today is Dr. Adeyemi Johnson. He's a seasoned interventional cardiologist, trained in the USA and a pioneer of advanced cardiovascular healthcare in Nigeria. He graduated from the College of Medicine, University of Lagos in 1981, and began his postgraduate training at Yale University in Connecticut in the USA, where he enrolled in the Masters in Public Health and Preventative Medicine program. He relocated to Nigeria in 2008 and founded First Cardiology Consult Limited. He has pioneered contemporary invasive cardiology in Nigeria and has performed several procedures, including the first coronary angioplasty with a stent implantation in Nigeria. Amazing. He also now performs these procedures routinely. Dr. Johnson has also established a non-surgical peripheral vascular disease program to restore blood flow to blocked arteries of the arms and legs. He has been involved in healthcare development in other domains in Nigeria and in Africa. He was chief executive officer of the international team that managed the ultra-modern Ibom multispeciality hospital in Uyo. He's involved in healthcare advocacy and has been the chairman of the Lagos chapter of the Nigerian Cardiovascular Society. He sits on many national and African healthcare-related committees. He's a patriotic Nigerian who has occupied many leadership positions both locally and internationally. He's passionate about improving healthcare in Nigeria and continues to innovate on ways to make the healthcare infrastructure in Nigeria better. So please welcome, with your emojis, Dr. Johnson.
Flora, I need to unmute him. Okay, that's it. Yeah.
Dr. Johnson, over to you.
Okay. All right. Good afternoon, everybody. Thank you for joining this discussion. I'm going to try and make it. Can you hear me? Am I clear? Yes. Okay.
Yes,
I'm going to try and make it a discussion rather than a talk. I'd like it to be interactive. So I discuss what people want to hear. But basically, I'm a cardiologist. I treat heart attacks, strokes, and things like that. And unfortunately, contrary to what many people believe, we do have a lot of heart attacks, strokes, cardiac arrest in Nigeria. We do have a lot. And this year in particular, I am not sure why, but majority of the heart attacks we had this year were in young people in their 40s, and a lot of them were women. So I do not think we're immune to this thing. So it'd be nice to listen and see what you can do to prevent this. And you have probably seen it in the news, some famous people having cardiac arrest while they're playing basketball. And luckily they were able to be resuscitated and things like that. I'm sure you all heard about the Lakers star's son and things like that. So this is things we need to discuss in Nigeria now. Okay, so let's see. Are you at risk for a heart attack? If you answer no to all these questions, then you can probably switch off and go and do something else. So let's see. Let's start with the first question. Does anybody in your family have a history of heart disease, hypertension, or diabetes? Anybody in your family, that is brother, sister, auntie, uncle? If it's yes, then that puts you at a bit of a higher risk. Are you overweight? BMI is anything above 25, so 26 and above. Many of you do not know your BMI. I guess you can't see me on this screen, but generally speaking, most of us I know are overweight. We're not obese, but many of us are overweight. So that puts us at risk. The more overweight you are, the higher your risk. Do you have hypertension? And just in case I forget to say it later on, hypertension is very, very common in Nigeria. It is an epidemic in Nigeria. And when you look at the WHO map for incidence of hypertension, dark red is very high incidence. Yellow is low incidence. We are dark red in Nigeria. And one of the reasons is the amount of salt we eat. Recommended salt intake is supposed to be 2 grams of sodium a day. Now, in Nigeria, it is difficult to measure how much sodium is in our food because we buy our stuff from the market and things like that. But let me give you an idea. In the US, the average salt intake is about 6 to 7 grams. In the UK, it's about 4. And that's because there's a law, there's a law that was passed in the UK several years ago, about over 10, 15 years ago, where restaurants could not add salt to the food. So and after that, the incidence of stroke and heart attacks went down. Now in Nigeria, guess what it is? Let me see if anybody. I can't see the chat thing, but anybody giving any idea of how much it is in Nigeria? What our salt intake is? No responses
yet. Not yet. Can anyone tell us what the salt intake is? Average salt intake in Nigeria is? No responses.
Okay. Anyway, it's 12 grams. So when a Nigerian says I eat normal salt, you know that they're already way overboard. All right. Okay. So that's that about salt and hypertension. And remember, one of the sources of salt that many of us do not realize, I only found out about 2 years ago, is ekpa, groundnuts, cashew nuts, almonds. Many of these nuts are salted, and they do add to our salt intake. They do add to our salt intake and contributes to the people whose blood pressure we can't control with regular medication. So remember, groundnuts, unless you get the unsalted groundnuts, but those ones we buy on the roadside in the bottles, they're actually fried in salt. Diabetes, also another strong risk factor for heart disease and strokes. Smoking. Luckily, this is not a big problem in Nigeria, but it is going higher. And this one is a totally irresponsible risk factor. I used to smoke, and so I know what it's like to try and stop smoking, but this one is like driving an Okada one way, blindfolded on the Ikorodu road and expecting to get to the end of the road in one piece. Stressful environment. This is what will catch all of us in Nigeria, except those of you who work in banks and lawyers and people who have nice cushy jobs. Nigeria can be quite a stressful place. So stress does significantly increase your risk for problems. And if you look to the literature, you will find out that during earthquakes, volcanoes, there are a lot more heart attacks and strokes than the usual incidence of heart attacks and strokes, and that's because of the stress. Okay, another one that many of us are guilty of, lack of exercise. You need to exercise more than 3 times a week for at least 20 minutes. It doesn't have to be running. Just walking is fine. Bottom line is any kind of exercise you will do is okay. It is much better than just sitting down and not exercising. You don't have to go outside. You don't have to go and buy expensive gym equipment. Walking is just fine. Swimming is fine. Anything that you will do that make you move around. They say 10,000 steps. It's not easy to do 10,000 steps, but 5,000 is just fine. So move around. High cholesterol. Now, all of us should know our numbers. You need to know your blood pressure. You need to know your cholesterol level. This is important. Do not wait for the doctor to tell you it is high. Because if you have a brother who has heart trouble, you have an aunt who has heart trouble, your cholesterol that needs to be controlled. And don't wait for somebody to say, oh, yours is normal, it's not normal. You need to know your numbers yourself and track the numbers. And then we'll talk about what causes high cholesterol. And anybody above the age of 40. And we might have to reduce this now because, like I said earlier on this year, quite a few people came in with heart attacks in their 30s, 40s. And I'm not sure why. I really am not sure why yet. Wonder if it has anything to do with long COVID, but quite a few people did come in and are still coming in. And the average age of Nigerians coming in with heart attacks is much lower than it used to be. In those days, it'd be 60, 70. Now it's in the 40s. So please, let's look after ourselves. Now, diabetes. Very important disease. And bottom line with diabetes is it is a very strong risk factor for heart disease, for vascular disease, where you lose your legs, amputations, and strokes. It is a big risk factor. But the important thing is this. If you treat your diabetes properly, you don't have that risk. So it is important to please, if you are told you have diabetes or pre-diabetes, take the medications your doctor gives you. Don't think you don't need them. Exercise regularly, it helps. And eat properly. We'll talk about the diet later on, but 7 in 10 people over the age of 65 who have diabetes will die of some type of heart disease. Okay, question. How many gallons of blood does your heart pump daily? So let's see what people will say. A, 100 gallons a day. B, 500 gallons a day. C, 2,000 gallons a day. And D, 5,000 gallons a day. So what, anybody?
We have someone saying D.
Like D, okay.
Well, we have 3 people have said D.
Okay.
Anyone else want to guess? Oh, well, most people are saying D. We have 1 person who has said C.
Okay, well, the answer is C, 2,000. gallons of blood a day. So what does that mean? That means your heart beats about 100,000 times a day. So somebody who's about 60 years old, his heart would have, beat 2.5 billion times. By the time you're 60, that's how many times your heart has been pumping. So your heart works very hard. Now, if I ask people, when do you service your car? Most will know. When you service your gen, most will know. But we tend to ignore our heart that works a lot harder than all these things. So please, you've got to look after your heart. You've got to check it. You've got to go for what they call preventive maintenance. Go for your yearly checks with your doctor, with your general practitioner, and let them check you out. And that's just like servicing your car. Go in for routine checks. If they say you have high cholesterol, you have hypertension, do what they tell you to do to reduce your chances, because it is much cheaper to prevent a heart attack than it is to have one. It is very expensive, especially these days that our Naira is not as strong as it used to be. Things are very expensive. So it's better not to have a heart attack. Okay, another quick question here. What is the immediate cause of a heart attack? A, blood clots in the coronary artery. B, cholesterol buildup in the coronary artery. C, damage to the heart valves. D, hypertension. Let's see what people say.
Any takers? We've got B. One person saying A. Lots of people saying A, and a few D's and B's.
Okay. It's A. It's a blood clot. Let me see if I have a picture. I have some diagrams showing that, but it's a blood clot. What happens is cholesterol builds up in the blood vessel. All right, that causes narrowing. But what causes the heart attack is that blood vessel shuts down, and it's usually a blood clot that comes into the cholesterol buildup in the blood vessel and shuts it down, and then that part of the heart gets damaged, and that's what the heart attack is. Okay, some things people say about heart disease. I remember when I was in the US and I was trying to come back, I spoke to some of the leadership in those days. That was the military time. And they dismissed me, said, we don't need cardiology in Nigeria. We don't have heart trouble. So don't worry about it. Okay, I stayed there. Many people think it's a male disease. Like I told you, a lot of women are coming in with heart disease these days, a lot of women. And once a woman develops heart disease, the prognosis is worse than if it is in a man. So please, ladies, take this thing very, very seriously. Many people think it's all not preventable. It is very preventable. I can safely tell you 80% of the heart attacks and strokes we see as cardiologists, 80% of them are preventable, could be avoided. Yes, some things you can't avoid, but 80% of heart attacks and strokes are preventable. It is not a disease of rich people. Heart attacks and strokes hit every socioeconomic class, So it's not just a disease of rich people. And maybe rich people come to the hospital because they can afford it, but please, everybody is at risk. Then there's some discussion about Viagra. A lot of people have this misconception that Viagra is dangerous for your heart. The fact is, this is the exact opposite. Viagra, people might not realize, initially was being developed to treat heart disease. It dilates blood vessels, so it improves blood supply to the heart and to the brain. But during their research, they found out that the side effects are fixed erectile dysfunction. And the companies decided, well, we better focus on this. This will give us more money than if it's for the heart. And true enough, Viagra was a hot seller, still is. So Viagra is generally safe. There are one or two conditions that make it not safe, but those conditions require you taking a particular drug that makes your blood pressure drop drastically when you take it with Viagra. That's nitroglycerin. So in general, Viagra is safe. Coffee, a lot of people think coffee is bad. All the data so far, and a lot of research has been done on coffee. Coffee does not put you at risk for heart attack and strokes. And in some studies, it actually improves things for you, helps reduce the chances you get Parkinson's or dementia. So, I mean, of course, if you drink 10 cups of coffee a day, that's probably not a good idea. But generally, a couple of cups of coffee is safe. And then, of course, in Nigeria, it is the wicked have done their work. The village people are throwing darts at you, and that's what's going on. But like I said, a lot of it is preventable. Okay, so what are the heart diseases? We'll go through them, and I'll talk about one or two things that are not written in this list, but there's hypertension. Some people call it a disease, some people call it a risk factor, but hypertension is a disease. And it is the commonest cardiac problem in Nigeria. And we have one of the highest incidences in the world. And that is probably related to our salt intake. Like I said, we take excessive amounts of salt compared to the rest of the world. Other common heart diseases are stroke. I'll describe what a stroke is, heart attack, heart failure, cardiac arrest. Now, these three I just mentioned, many people, non-medical people, do not know the difference. They just think they're all the same. And they're not exactly the same. And I'll explain the differences. And what happened to those basketball players, football players that drop suddenly on while they're playing basketball or football is a cardiac arrest. And I'll explain that in a minute. So let's talk about stroke. Now, what a stroke is interruption of blood supply to the brain. All right. Now, that interruption can happen by blood clots. It can happen with bleeding into the brain, and it can happen with head trauma. But it's essentially damage to the brain because there's not enough oxygen being delivered to that part of the brain. So, can you see? Yes. All right. So this is the brain here. All right. Let me try and explain what's going on here. Now, this is the blood vessel. This is normal blood vessel. It's open. Where my cursor is, this is open. Now, what happens in a stroke is there's narrowing here, and then this in the middle is a blood clot. All right. And then when the blood clot is there, blood cannot get through to that part of the brain, and it causes damage to that part of the brain. And that's what is called an ischemic stroke. Important thing with strokes is this. And please take note, if you have somebody who has signs of a stroke, I'll go through that in a second, please get them to a hospital that can take care of this as soon as possible because there is treatment. If you get there and we're able to take care of that blood clot within 4 hours, in some cases 6, person can recover almost all function. But once it's after 4-6 hours, the chances are damage is permanent, and all you're looking at now is a rehab. So please remember, once you have signs of a stroke, go to a hospital that can handle this. You first take aspirin, and then you get yourself to hospital or your family members. So you young people, if you see your parents or family member or friends or colleagues behaving like they have a stroke, and I'll tell you some of the symptoms, please go straight to the hospital. Okay, this is the other type of stroke, bleeding into the brain. So this is the blood vessel. This is what we call an aneurysm. You see the vessel is not straight, it pouches out. There's an outpouching of the blood vessel. This outpouching is prone to rupture. And when it ruptures, blood now comes out of the blood vessel and then goes directly into the brain and damages that part of the brain. That's what we call a hemorrhagic stroke. So this is common in people who have aneurysms and in people who have uncontrolled blood pressure. Blood pressure will rupture the vessel. Okay, and this is what atherosclerosis looks like. All that puff, akara, all those nice things, chicken wings, small chops, fried foods. This is what happens. The cholesterol from them now develops in the blood vessels. So you see this narrowing here. There's significant narrowing, blood is still going through, but all it takes is a little blood clot to form here, and then bam, you've got a stroke. So please, when you're eating all these bad foods, fried meat and things, remember that this is what you're doing to yourself. Okay, signs of a stroke. Now, this is very important. The biggest sign most people know is somebody gets paralyzed on one side. That's the commonest sign. That's one everybody knows. So once you have that, please get the person to the hospital immediately. Headache, especially when the person says, this is the worst headache I've ever had. That could be the early sign of an aneurysm rupturing. Get straight to the hospital. These things can be treated. All right. Sudden loss of consciousness. It could be a stroke. It could be cardiac arrest, but sudden loss of consciousness, you need to start CPR and all those things. This is not, we can't teach CPR today, but this is something we should all learn how to do. It saves lives. Somebody complains of blurred vision, especially if it's blurred for a minute or two and then it comes right back. That might be a stroke about to start. You go straight to the hospital. All right. You see the face on one side drooping. Many times that's a stroke starting. Slurred speech, somebody's talking and then suddenly it sounds like they're drunk. Do not assume they're drunk, especially if they've been with you all day and not been drinking. Slurred speech could be the beginning of a stroke. And of course, loss of balance. That's another sign of a stroke. So when you have any of these things, they're not always indicative of a stroke, but they could be, and it is better to get to the hospital early, where if it is indeed a stroke, it can be treated immediately and reverse the damage. Okay, heart attack. Many of us use that term. We're not sure what it means, but let me explain what a heart attack is. Okay, now this is the heart. All right, this part here, this is the heart muscle here. This is called the left ventricle. All right, now these red things here, these are the coronary arteries. They supply blood to the heart. All right, and with the blood comes oxygen that feeds the heart muscle. So these blood vessels are what supply blood to the heart. All right, these big ones take blood away from the heart to the rest of the body. Now, what happens is, in a heart attack, I showed you the picture of a stroke where you see the inside of the blood vessel gets blocked and then a blood clot shuts it off. Now, if you have a blockage in this part of the heart here, I hope you can see my cursor. If blockage is here, the blood clot blocks it here, this part of the heart that is supplied by that blood vessel gets damaged. All right, that's what a heart attack is. It's different from cardiac arrest. This one, it just causes damage. That damage can lead to other problems, but the damage is here. And usually the patient would have chest pain, shortness of breath, and some other signs I'll talk about. But that is what a heart attack is. It's similar to the physiology of a stroke. There's a blood clot or there's a rupture, and then that part gets damaged. It's the same thing. But this time it happens in the heart. So normal blood vessel here. This is what it is like when you're born. Nice, clean endothelium. Then when you start to eat all those nice foods, sausage roll, bacon and eggs, or fada stew, is it designer stew they call it, fried food, then the yellow spot starts to develop within the blood vessel. And then it gets more. The older you get or you start to smoke, then you see this part here. This is called a plaque. That is, the lining of this blood vessel has opened up like an ulcer, like a cut inside the blood vessel. Once there's a cut there, it's called an ulcer, ulcerated plaque. Then a blood clot now comes to try and fix that clot. And then the blood clot gets bigger and bigger, and then it blocks off the blood vessel. And then you get something like this. And then that blocks the blood vessel. And then that part of the heart, like I said, gets damaged. If the blockage is up here, as you can imagine, it is a much bigger heart attack. If it's down here, small heart attack. So it all depends on where the blockage happens. So the medical term for heart attack is a myocardial infarction. And basically, it is interruption of the blood supply to the heart, which results in damage to the heart muscle. And that can now lead to heart failure or cardiac arrest. I just want to bring this up briefly. This is not my main talk today, but I thought I'd bring it up. Even in the developed countries, women were not regarded as being at high risk for heart attacks. So not much attention was paid to women with heart attacks. But let me just give you some statistics. For every woman that dies from breast cancer, 6 will die from heart disease. So you see, many women think breast cancer is the biggest problem. No, it isn't. It's still heart disease. Everyone that dies, 6 will die from heart disease. Younger women are twice as likely to die from a heart attack than younger men. And that's what's been happening in our practice here in Lagos. And there's a higher mortality risk in younger versus older women. And for a variety of reasons, if you're a young lady in your 30s, 40s, you have a heart attack, the chances of you dying are higher than a 70-year-old woman who's had a heart attack. So I just wanted to bring that about. So now, what are the typical signs? Because men were studied more frequently in those days, most of the signs were in men. Nausea, vomiting, jaw pain, neck pain, back pain. Somebody tells you they have chest pain and it's going into their teeth. 9 times out of 10 is the heart. All right. If the chest pain is going into the teeth, it's not toothache. It's most likely a heart attack. Chest pain is usually described as squeezing or pressure. Somebody sitting on my chest. Then you'll be thinking about heart disease. And then there's usually shortness of breath and sweating. Now, in women, see, the list is longer. And so it can be missed because we have the normal nausea, vomiting, jaw pain, upper back pain, chest pain. But then women can come with upper abdominal pain. In fact, the first lady we did an angioplasty on in Nigeria, a retired nurse, her complaint was stomach pain in her abdomen. And if you don't look properly, you will be treating her for an ulcer and then find out it was a heart attack. A lady yesterday that we did who came with a heart attack, she had been going to hospital for about a week and they were treating her for an ulcer. Turns out it was a heart attack. So ladies, you got to be a bit more astute and careful about your symptoms. It's not always what it seems. Fainting, indigestion, extreme fatigue. The most dramatic case I had was a woman who came in with a migraine. And the only way they found that, they treated her with everything, including morphine, the headache wouldn't go away. So it was decided to admit her. And in the US then, once you're admitted, you're going to get an ECG. So an ECG was done and they saw it was a heart attack. And that just shocked all of us. Headache being caused by a heart attack. So women, any symptoms that you're not sure about, just have it checked out. Just have it checked out. Okay, so let's go to how we prevent all this stuff. Now, let me explain the food. It is not cholesterol in the food that causes trouble. It is saturated fats, all right? So saturated fats and trans fats, but not cholesterol. The reason why this is important is this. Foods like eggs, lobster, shrimp are high in cholesterol, but they're not high in saturated fat. And that cholesterol is not converted to the bad cholesterol. So it's important to note this. You can eat eggs, you can eat yolk. I mean, it doesn't mean you eat 10 eggs a day, but eggs, lobsters, shrimp, shellfish in general are high in cholesterol, but they're not dangerous for you. So you can remove that from your list of not to do's if you're worried about your cholesterol. Now, the trans fats are found in fried foods, cookies, cakes, crackers, and snack foods. These are the worst fats. They've been banned. Oils that are high in trans fatty acids have been banned worldwide, but you still get them. They're difficult to regulate. So just beware. Cookies, fried cakes, snack foods, usually high in trans fats, and these are the ones that raise your bad cholesterol. Okay, so what else can we do? So diet is one. Eat healthy. All right. Fried food is a no-no in general. Fried food is not good. It doesn't mean you cannot eat meat. It just means don't in the morning eat corned beef stew. Then in the afternoon eat a father rice with a designer stew. Then at night eat fried meat or something on suya. You're just looking for trouble. So, just limit the quantity. The more meat you eat in general, the higher your chances of a heart attack and of cancer. So I'm not saying don't eat meat, but remember, meat should be taken as little as possible. All right. Physical activity, another big one. Studies have shown in identical twins, one who exercises and the other who doesn't exercise, the one who exercises tends to live longer, tends to live without more disabilities. So please, exercise. And like I said, do not wait for when you have enough money to buy a gym or join a club or things like that. Just find a way to move your body. Don't sit down on a chair all day. Move around. Any exercise is helpful. Any exercise. Okay, weight. You guys can't see my picture here, but I usually say if you're bigger than me, you are fat. But generally speaking, you want your BMI to be below 25, 26. And that will help you. But if you're overweight, and most of us know when we're overweight, you see your tummy hanging down, you have what do you call it, tires around your waist, you're overweight. And you don't have to go from 110 kilos down to like my weight of 70. No. If you can lose 5 to 10 pounds or 5 to 10 kilos, if you're above 100, it is helpful. It is all helpful. And what weight loss does, it reduces your bad cholesterol, it reduces your triglycerides, and it also helps you improve your good cholesterol. That's HDL, is good cholesterol. Okay, high blood pressure. This is a big one in Nigeria. Big. I think this is the biggest risk factor we have. High blood pressure and diabetes. You want your blood pressure to be below 120 for the top and 80 for the bottom. Now, this is quite strict. This is the American recommendation. The European recommendation is below 140 and below 90. But generally, once you start seeing 140 and above, your blood pressure is too high. So you want to bring it as close to this as possible. And remember, many people tell me, oh, their pressure came to 110, so they thought it was too low, so they stopped taking their drugs. No. Keep taking your drugs. 110 is even better than 120, so that is perfect. Women generally will be about 100, 90 to 100. That's fine. So please lower your blood pressure, generally the better, and take your drugs. The most common reason why men don't take their blood pressure drugs is erectile dysfunction. Now, it is important you're honest with your doctor. Let them know that this drug has caused you some difficulties. There are over 1,000 drugs. We'll find one that will help you out. And so do not stop your drugs just because of that. Because the truth is, if you have a stroke, this erectile dysfunction you're worried about will no longer be of any, will no longer be a discussion, because that part of your life will be over, completely over. So the first thing, don't get a stroke. Just do that first. Don't get a stroke. So, like I said, maintain the ideal body weight. A diet rich in fruits, vegetables, low-fatty dairy products is also good. So the more fruits and veg we eat, the better off we are. And now, our own vegetable soup, egusi, efo, and all those things, they're actually quite good. All right? Just do not cook them with too much oil. And they're actually healthy. Don't forget, we reduce our sodium as much as possible, and do not forget Maggi cubes, bouillon cubes, groundnuts, cashew nuts, almonds tend to be all salted. Increase your physical activity, and alcohol will raise your blood pressure. So alcohol is not a no-no, but please don't drink a lot of alcohol. Maybe one beer, one glass of wine every now and then is okay. I drink my alcohol, but I try not to drink excessively, because it will cause trouble. It can damage your heart. It can cause blood pressure. It can cause a lot of problems. So don't forget, exercise. Whatever you do, exercise will control your cholesterol, help you control cholesterol, help you control diabetes. All right. This is very important for diabetics. Exercise. In my family, we all have diabetes. All of us, father, mother, everybody. But I developed mine in my 60s. My brothers got theirs in their 40s. And the only difference was exercise. I have always been somebody who exercises a lot. So it helped me get the diabetes later in life than earlier in life. And the later in life you get your diabetes, the less time diabetes has to cause trouble in you. So please remember, exercise is important. And exercise also helps you lower your blood pressure. If you go jogging in the morning and you come back, check your blood pressure. You'll find out it's lower than when you went. So exercise really does work. Okay, now to talk a little bit about pulmonary embolism, because that seems to be an epidemic in Nigeria. Pulmonary embolism is a blood clot to your lungs. It is more common than heart attacks in Nigeria, and I'm not so sure why, but it is very, very common. I have seen my first year back in Nigeria, I saw more pulmonary embolisms in that year than I did my whole career in my whole 28 years in the US. So it is very common here. And one of the causes are oral contraceptives. All right, oral contraceptives do predispose you to deep vein thrombosis. So when you see a lady with blood clots in the leg or swelling in the leg who's on oral contraception, this is important to note. It does put you at increased risk. So do not think oral contraceptives are totally benign. I'm not saying you shouldn't take them, but no, it puts you at increased risk. So if you do take them, exercise regularly to try and prevent this from happening. And if you do get leg swelling, please come to the doctor immediately. So we've been through this now. Start today. Exercise. Sorry, I should have my phone off. Follow a good diet. Low in saturated fats. Limit your salt. And if you drink alcoholic beverages, do not drink more than one a day. Please, if you smoke, try and stop. I used to smoke, so I know what it's like. I saw one of my closest friends die from lung cancer. That's when I stopped smoking. It's not just heart disease, it's cancer everywhere. Lung cancer, brain cancer, throat cancer, liver cancer. Smoking is just bad news. You might as well just go and do Russian roulette and see which one is safer, but smoking is not good. Check your blood pressure. So go for your regular check with your doctor. When you have diabetes, please take the medications they give you. All right, please take the medications, eat right. So preventive maintenance, go for your regular screening. See your GP regularly, at least once a year, or as often as they tell you to. And they will check your blood pressure, check your weight, examine you, do some blood tests that will include glucose, lipids, kidney function. An ECG will be done, which will give us an idea of how good your heart is. Echocardiogram will give us a good idea of heart function. A stress test will tell us if you're at risk for, if there's already beginning to be narrowing in your blood vessels. Calcium scoring is a test done with CT scan where we look at the amount of calcium in your blood vessels. 0 is normal. Above 10 is not normal. 100, 300, 700, very abnormal. So these are tests we can do. And if we see any abnormality, means we need to double up on reducing your risk factors. And please go for your colon cancer screening. Okay, now, how to survive a heart attack or stroke in Nigeria. Now, there are many things on the internet or WhatsApp saying you rub your elbow, you do some kind of funny coughing. Please, those are people, very imaginative people. Basically, what we know is take an aspirin. All right, whatever type of aspirin you have, 300 milligrams, 75, anyone, take the aspirin. It does help in a lot of people. But by the time they come to the hospital, after they've taken aspirin, the clot has started to dissolve. So it's important, take an aspirin. We generally recommend 300 milligrams or 325, whichever one, US or UK version, but take your aspirin. All right, as soon as you think you have a heart attack or somebody near you having chest pain, take the aspirin. Even if it's not a heart attack, it's not going to cause any harm. But if it is a heart attack, it's going to help. You need to know the hospitals around you. Now, those of you in your 20s, 30s, and could be saying, that doesn't concern me. But remember, it might be your father, your mother, your auntie, your relative, your colleague, your teacher, somebody. So you need to know the hospitals around you and find out. Go to the hospital, find out if they have the resources to quickly diagnose and treat the symptoms of a heart attack or stroke. If you have a heart attack, if you think you're having a heart attack, please try not to drive yourself to the hospital. But I understand in our own peculiar circumstances in Nigeria, sometimes you have to do the driving yourself because you don't have a driver at 2 a.m. and things like that. But get yourself to a hospital. So scout around, find out the hospitals that can treat you. And then go straight there. And then know the warning signs. We've been through the warning signs. So with that, I think I've come to the end of my presentation. And if there are any questions, I'll be glad to take them.
Yes, we have loads of questions. Please, could you stop sharing? Yeah, perfect. Okay, so the first question from Lion, when you were talking about strokes, she says, please explain why heart attack or strokes are more common in women than in men.
Okay, no, not that they're more common. No, they're not more common in women than men. Before menopause, they're more common in men. After menopause, women catch up with men because the estrogens sort of protect the ladies from heart disease. But after menopause, you catch up with men. The incidence has always been higher in men. Lately, in places in the Western world, women have started to have more heart attacks and strokes, and that's because women are beginning to smoke more than the men, and that puts them at higher risk. But generally, no. What happens is women, when they get a heart attack or stroke, their prognosis is worse than in men. And there are various theories to that, but one of them is that their arteries are smaller and actually more difficult to treat than the bigger vessels. When you're doing an angioplasty or stent, it's easier to put a stent in a big vessel than a small vessel. So that's one of the reasons why they don't do as well, especially young women. Don't do as well with a heart attack. So best thing, prevent it.
Okay, thank you. You mentioned something about coffee. So someone was saying, did you say coffee is bad for the heart or is it good for the heart?
No, coffee is neutral to good. Neutral to good. There is a small subset of people who should not take coffee. These are people who have arrhythmias that coffee can make worse. So if you have an arrhythmia, coffee will make it worse. Arrhythmia is an irregular heartbeat.
All right. What is the standard blood pressure now for age 60 plus?
And that's my age, so I know. You want it under 140 and the bottom number under 90. US standards is under 130. European standards, which I tend to follow because it is difficult to keep your blood pressure below 120. It is very difficult.
So 140 over 90?
No. Below 140 over 90. Below 140 over 90 is hypertension. That is hypertension already. So below 140 over 90.
So we want it below 140 and below 90.
Yes.
Okay, you mentioned about older women recovering quicker than younger women. So somebody's asking why.
Okay. Yes, it is true. The reason is this. Let me see if I can explain this to make sense. What happens is when you have narrow blood vessels, all right, over time, the body starts to develop natural bypasses around that blockage. All right, smaller blood vessels develop around that blockage. So when that blood vessel blocks off completely, there's some smaller vessels taking some blood, at least to the other part of the heart. But in younger people, they haven't had time to develop those collaterals, and there's no backup system. So as soon as it cuts off, there's significant damage right away. In older people, the damage is less severe than in younger people because they've had it for a while and they have those natural collaterals going around the blockage.
Okay. Just to say, if you have any questions or comments, you can raise your hand. So we'll make it as interactive as possible. So I'll just take this question from Dr. Salisu and then we go to the rest. Dr. Salisu?
All right. Thank you so much found me such a long time. I'm happy to be here. I quickly saw the link and I rushed down.
Nice
All right,
one.
thank you so much. This has been an interesting webinar. Thank God I didn't miss it. Thank you so much, Doctor.
Good.
I'm really grateful. Yeah. What I want to ask is the pastry. Is it that we should abstain from it completely, or we can have it once in a while since we are going to be having the exercise? That's one. Then two, the ratio of LDL and HDL. Do we have a kind of a ratio, just like the way you have the systolic and diastolic for the fat side now, since you the fact that HDL fat should be more? Must we have a particular ratio? Because I think I've read a lot of things about there has to be balance, or one has to be high or low, kind of a ratio. Thank you.
Well, I'm sorry to say this ratio thing is no longer a big deal. Reason is some recent studies have shown we used to be happy about high HDL. Turns out maybe good HDL, high HDL is not protective like we used to think. So bottom line is this. The only thing we can treat with drugs that has been shown to reduce your chances of a heart attack or stroke is the LDL. Any other drug that raises HDL, actually, they're like nicotinic acid raises your HDL. It's actually associated with a higher incidence of strokes or heart attacks, sorry. So the focus for us in cardiology is LDL. We want to bring it down. If you've never had heart disease, you're a young person, generally anything under 120 milligrams, I use the American system, milligrams is fine. If you've had a heart attack or stroke, we go down to below 55, which is very low. All right. So we look at HDL, but we don't do much about it because the only things that have been shown to reduce your chances are statin drugs, and they bring down the LDL, and that's what we can treat. Now there's Lp(a) and some complex things. The treatment is still attack the LDL for now till newer drugs come out. So I personally don't look at the ratio any longer. I don't. I just look at the LDL.
Dr. Salisu, does that answer your question?
Yes, sir. It just remains the perform meat pies of the thing.
I think you know the answer to that, though.
We have not made meal. What simply make, I don't know. I mean, part of the academia, we take.
I'm not even sure how pastries are made, but I think there's a lot of fat in them. I don't know. But meat pie, chicken pie, fish pie, they're all not healthy. So the less you eat, the better. There's no zero. There's nothing like zero. We are human beings. We have to live our life. And there's no point living to 100 and not enjoying your life. And then you die at 100 and then you haven't eaten meat pie before. Well, I don't know what kind of life that is. So yes, things in moderation are always okay. But the more meat pie you eat, more sausage roll, the higher your risk of heart trouble. But generally, anything in, I would say everything in moderation.
All right, Dr. Salisu, is that okay?
Thank you so much. Thank you so much. Thank you, sir.
All right, the next question from DA is, how does diabetes contribute to heart attacks or heart failure?
Diabetes is probably the biggest risk factor, second to family history. Basically, to simplify it, diabetes works in many different ways to cause trouble. It affects small blood vessels, affects large blood vessels, it affects the eyes, retina, and all those things. But the way it works to cause a heart attack in simple terms is diabetes works with the cholesterol plaques in your body. All right. So any cholesterol in your system, in the liver and all, diabetes somehow makes that cholesterol stick to your blood vessels. All right. And also puts those blood vessels at risk of getting ulcerated and blood clots forming. So that is the simplest stuff. It's very complex, but simplest way is it works with the cholesterol, the bad cholesterol, puts them in the blood vessels to cause trouble. And diabetes, but controlling your diabetes. And once you have diabetes, by definition, you must be on a statin drug, even if your cholesterol is normal, because it works with the cholesterol to cause trouble and brings the cholesterol from the liver and other places into the blood vessels.
Thank you for that. Yeah, I hope that answers your question. So, our next person, Essen Vosa. If you can unmute yourself and ask your question.
Yes, good afternoon. Thank you, sir, for the presentation. Yeah, I work with the News Agency of Nigeria. I report for the News Agency of Nigeria. Sir, I just want to find out how much awareness creation is being done in this area. Do you partner with the media, to inform the public? That's my question. And what's the statistics of cardiologists so far in the country? Thank you.
Okay. Yes, I personally and many of the cardiologists have partnered with the news agencies to increase awareness. I am not sure it is being done on a consistent basis or as often as it should be done, but we do try, especially on World Heart Day and things like that. That we try and broadcast and let people know we have walks, we have talks on TV, on radio, and things like that. But you see, there's a little problem with that, a little problem. The law in Nigeria says we are not allowed to advertise or market as doctors. So when you go on TV or the media and you start to talk, you've got to be very careful crossing the line from education to marketing. So many doctors just don't want problems and they just shy away from the media. So that's one of the reasons why I see doctors shy away. But I've gone to read this thing and I've spoken to lawyers. The marketing is allowed for hospitals. It's doctors that are not allowed to market. So once they see it as marketing, it's a gray line. And so that's why a lot of us are shy about it. In places like the US, you can say I'm the best doctor that God ever invented. It's fine. But in Nigeria, one of the reasons why they have that law is so there's no false advertising. So people don't claim they can do what they can't do. So it's a delicate line. So that's one of the reasons you don't see us rushing to the media, because we don't want any trouble. And cardiologists, we are not enough. We are not enough. I do not know the exact number, but almost all of us know ourselves. So that shows we're not enough. Our numbers are much lower than they should be, much lower. And then the different subspecialties of cardiology were even less. So interventional cardiology, I think we're about 10 in the country. In my practice in the US, there were 18 of us in just that group, in just that town, in my own group. And there were like 4 other big groups. So the numbers are very low. And as some people qualify, they japa and move on. So we have a crisis as far as numbers go.
All right, thank you. Mr. William, just unmute yourself and ask a question, please.
Hello?
Yes, we can hear you.
Doctor, I feel highly humbled and honored that I'm participating in this program. You've spoken, but I want you to please kindly do us a favor by addressing this issue of heart enlargement. What are the causes? Can its escalation be controlled? And for example, bringing it back to a size, when you say something is enlarged, definitely it must have gone out of proportion. So what can be done effectively to prevent the escalation of the enlargement?
Okay, that's a very
am I making, do I make sense?
Yes, you do.
Hello?
Yes, you do. Heart enlargement, let me break it down. There's enlargement of the muscle is thicker, and then there's enlargement of the chamber. Now, both are not good, all right? But the most common cause of enlargement of the heart is hypertension, most common cause, all right? So look at it as your heart is pumping blood right now, your normal weight, normal blood pressure is pumping blood to the first floor. Then when you develop blood pressure, you're now putting weights. You're carrying your blood with weights on it. So you're making the heart do extra work. So just like when you lift weights, that's how you build up your muscle. but in the heart, that building up of muscle is not healthy. All right, except in athletes. Athletes do have thicker heart muscles, but that's a different type of thickening, and that's usually healthy. So once your heart starts to get enlarged with hypertension, it is absolutely even more critical you control your blood pressure, because it's going to keep getting enlarged. And there's a certain point when it gets enlarged too, and then it becomes inefficient, and then you develop what is called heart failure. Heart failure is your heart is not able to pump out the volume of blood you require. So that's what's called heart failure. So heart failure is like a 6-cylinder car that the engine has knocked, and then only 2 cylinders are going. It will get you there, but it will be with a lot of crises. And that's what causes the leg swelling, the shortness of breath. So that's what heart failure is, and that's from a large heart. Now, theoretically, if the heart is slightly enlarged with some blood pressure medications and reducing your blood pressure, you can bring it back down. But realistically, what we do is try and stop it from getting bigger. That's the most important. We try and stop it, and the most important way is taking your drugs and reducing your blood pressure.
Thank you very much. I appreciate it.
And I can say 50% of the people who are sent to me with enlarged hearts, their hearts are fine. It's usually from X-ray that is poorly taken. An X-ray can suggest your heart is enlarged, and then but the gold standard for heart enlargement is an echocardiogram. So if an X-ray says heart enlargement, then it's best to say cardiologist get an echo and determine if it is indeed enlarged and what type of enlargement. So we can figure out what to do.
Thank you very much. I appreciate it.
Okay, thank you. I'll take a question from the chat. The person says they have a blood pressure averaging 106/60, and their heartbeat is 60. Is this okay for a 70-year-old man? And they hope
it is perfect. Not low. It is perfect. That is perfect.
Excellent. There we go. Lion, please ask your question. Unmute yourself.
Hello, sir.
Yeah, we can hear you.
See my face. Thank you very much. I'm super excited, sir, to have been on this platform, hearing you speak today. I have 3 questions, sir. One is a contribution. The first is I have a 20. Well, she's 24 now. She's going to be 24 tomorrow. When she was 20, she had a health. She had a health issue that was like she had malaria. But at the same, when they checked her blood pressure, it was a little bit low. And then the doctor, we had to go see a cardiologist. We were running her scatter. Then she said she complained that she had a pain that was coming from the heart. But when the long and short of it, or what the cardiologist said was she had a valve leak or something, that she's going to be fine, she will, because she's a very slim, beautiful girl. So she would outgrow or something like that. I am not comfortable because I'm a health activist. I know from what you just said now, it scares me. So I don't know when I'm going to bring her to see you. So it makes me very uncomfortable. But since then, she has not had any problem anymore, because they had to attach something to her heart that she wore for about a day to see how the heart was working. So I will want you to please advise, should I bring her to your cardiologist for you to do another? I will love that, because I want my daughter to live a healthier life than that I'm living. So my second question is, I'm living with type 2 diabetics for 23 years. I'm 54 now. And I stopped my aspirin some years ago because of the side effects I read about it. Now I've heard you spoken and I'm a little bit uncomfortable. Though I have a fantastic blood pressure, my blood pressure reads between 120, that's the systolic, and 60. It can be as low as 60 and 100/60, sometimes 120/80. Highest it goes is that. So I have a fantastic one, and my cholesterol is doing. I've tried to make sure that my cholesterol is within range, because I know a lot about. My last LD was fantastic. I can send that to you later, but I'm happy. It's doing better. So, but I'm afraid when I just listen to you now, I'm uncomfortable. That's the question. So please, do I go back to my aspirin? And how many milligrams should I go back? I'll find out from my doctor. I refuse. So please tell me, what is the danger I may encounter not taking it for the past almost 10 years? I've not been taking my aspirin. I take other TINA supplements like turmeric. I try to do natural. That's it. Then my contribution to bringing a person of your caliber to the world to hear you. For what you just did now, I had to connect a lot of people to join in. I've lost a couple of friends in this year to heart attack. Because what you were just saying just now, I don't know what is causing it. So I just lost some friends to heart attack. So I want to know how I can assure you that WHO, IDF, we want a person like you to come on board. I'm working with them. I'm a volunteer with them. Sir, you speaking on air, you talking about what you are doing is not good. It's not an advert. You are advocating. You are bringing it. You're saving life. So please, I'm going to find you. There's no hiding. I'm going to find you. Thank you very much.
Okay, thank you. The easy question: diabetes. You don't need aspirin, so don't worry about it. Aspirin is not recommended only for a few cases, like if you had a heart attack or you had a stent, or if I what we call a TIA or stroke. In general, the side effects of aspirin do not they outweigh the benefits in somebody with your profile. For your daughter, well, I don't know what tests they did, but if they say the valve is leaking, it's a bit unusual for a 20-year-old valve to be leaking. So it'd be interesting to note how significant is the leakage. Is it just trace? Is it mild? Is it something they call mitral valve prolapse? There are many, many things, but generally, I doubt that she has something significant going on. I doubt it, but it'd be good to be sure about this valve leakage and have an echo done or review the echo that was done or the report. Then, the other one was not a question, yeah.
All right, thank you for that. Let me just go quickly to Abiola Paul Oze. Could you unmute yourself and ask your question, please? Has it dropped off? Abiola, if you raise your hand again, then I can ask you to unmute because you just dropped off just now. All right, let's go to Atinuke Anayiga, please, if you can unmute yourself. Atinuke.
So,
thank you.
Good evening, everyone.
Good evening.
And thank you, Dr. Yemi Johnson, for that beautiful presentation. Now, my concern as also a health professional, is that from time to time, these things do come up and we get to learn people get to learn about what they should or what they shouldn't do. Now, my question is, a lot of people do their medicals and they find out that they say that they are not diabetic, they're fasting. But that doesn't mean, I just want you to mention a little bit about the pre-diabetic states and how easy and quickly, unknowingly, it could convert. So many times I do that, but what I now do at my age, I'm 60 something plus, so it's to also do my pre-diabetic so that at least I know that, I'm not either on borderline or I couldn't, tilt to such things, because you could be in that state and yet some risks are also high there. So thank you, Doctor, if you can just elaborate on this.
Okay, Dr. Noiga, very important question you asked. You brought up pre-diabetes. That's the non-medical term. The risk for heart attack and stroke in people with pre-diabetes is almost just as high as if you have diabetes. So it is important to know whether you're pre-diabetic or not. Using the milligrams, 80 to 100 is normal. for fasting blood sugar. Between 100 and 125 is pre-diabetes, what we call glucose intolerance. And then above 126 is diabetes. Once you keep getting fasting levels above 100, you are pre-diabetic and your risk is almost as high. And the recommendation is you should be on a statin drug. Now, I can say from my own personal experience, I was pre-diabetic for a long time. Ever since I remember, I was pre-diabetic. Well, no, I was normal because in those days, in the 80s and 90s, anything below 125 was called normal before they changed it to pre-diabetes and co. So I was always around 118, 110, 118, 110. Then one day they changed the rules and now said I was pre-diabetic. And before then, I was not taking the statin drugs. I just refused to take the statin drugs. Just refused. I had one reason or the other. Anyway, 2007, December 27, I ended up with a stent in my heart, and I didn't have symptoms. I was exercising regularly. I was smoking regularly, and I was not taking my statins regularly. And the last day at work, when I'd quit my job to come to Nigeria, I said, you guys, let's do an angiogram. So after work, put me on the table. Everybody was chit-chatting, laughing, and everybody suddenly became quiet. I looked at the screen. I saw a 99% blockage in one of my blood vessels. I said, damn. So this cholesterol medicine I've not been taking now. Anyway, that's how I went from taking 10 that I said was giving me trouble. I started taking 80 milligrams of, once you've seen eye to eye with a heart attack, you will take your drugs once you know the consequences. So I started taking my 80 milligrams quietly after the stent. And so, yes, pre-diabetes puts you at risk. So when they're checking for diabetes, it's the same testing to tell you whether you're pre-diabetic or not. But once you're pre-diabetic, please behave like a diabetic. It is important because your risk is just as high. And I'm telling you from experience.
Thank you, Dr. Johnson. I'll go to a question in the chat. They say someone has been experiencing weight loss in the last 2 years before hyperthyroidism was diagnosed. Meanwhile, the pulse is very high, 132. Any relationship to heart diseases?
But usually, hyperthyroidism will make your pulse rate go up, and it can affect your heart adversely, right? Because it's like running throughout your life. When you run, your heart rate goes to 120, 130. So it's like you're putting your heart at extra stress. So it needs to be brought down. And usually we treat that with beta blockers as while they're treating your thyroid. So generally you want the heart rate below 100. So it doesn't cause long-term problems. But it can cause long-term problems, and it frequently does happen. So first thing for us as cardiologists is to slow the heart rate down.
Great. Okay.
The medicines do not slow it down as quickly. The medicines for hyperthyroidism take time to work.
Okay. Now there's been some discussion about aspirin in the chat. So should people take aspirin? Who should take aspirin, and how much should they take?
The people who should take aspirin, the number has been reduced significantly. If you've had a heart attack, if you've had a stroke, aspirin, all right? If you've had what we call a TIA, we don't have enough time to go into TIA, but TIA is a precursor to stroke, aspirin, all right? If you have multiple risk factors, not one. So if you have high cholesterol, you have diabetes, you have hypertension, then we might consider aspirin. Other than that, it causes more trouble, especially bleeding problems. And you can bleed in your brain and get a stroke. So that's why we don't prescribe it as much. So the dose, 75 milligrams or 81. I think US is 81.
Yeah.
The other UK is 75. It's about the same. So baby aspirin is what we call it. So that is generally enough.
Only for those that you said should be on it.
Yes, who should be on it.
Okay. Emmy Aaron, unmute yourself, please, and ask your question. Emmy Aaron. All right, I'll go to Joanna Coker. Please unmute yourself. Joanna Coker?
Yeah, hi, hello.
Hello.
I came about 10 minutes down the line, but I'm just going to ask Dr. Johnson that I didn't hear him sort of making a lot of emphasis or saying much about obesity, which seems to be a major prevalent problem within our society. And the second thing was to ask him if it's possible to just sort of reorientate people's thinking about thinking that sugar is a cause for diabetes.
Okay. Let me take the sugar part first. No, sugar is not the cause of diabetes. In fact, sugar doesn't cause much trouble as far as diabetes is concerned because it depends on how much sugar you take. You take a cube or two of sugar, that's not going to cause diabetes. Now, what the problem, diabetes is caused by lack of insulin or shortage of insulin, all right, in your body. It's not sugar. And it's not generally what you eat. What you eat doesn't cause diabetes. But once you have diabetes, what you need to avoid is refined carbohydrates. That is the biggest issue, not sugar. I have diabetes. Most of the diseases I have. I take 1 cube of sugar with my coffee. It doesn't make my sugar go up at all. Now, if you take 4 or 5, it'll make your sugar go up, but it won't cause you diabetes. It'll just make your sugar go up if you have diabetes. But the biggest problem with diabetics and food in Nigeria is rice. Rice, white bread, eba, pounded yam. They are all carbohydrates and they're absorbed very quickly and they're converted to glucose very quickly. So for me, 2 slices of white bread, within 30 minutes, my sugar has gone up to 200. All right, but brown bread, it stays flat. Amala, it stays flat. Eba, it goes up. So it is carbohydrates, refined carbohydrates especially. But if you don't have diabetes, you don't have a risk for diabetes, you don't need to be afraid of taking sugar or rice or dodo and all those things. But those of us who have diabetes, that those things are not good. So if you have pre-diabetes as well, the same thing. Eat like you already have diabetes, so your sugar is under control. Now, obesity. I thought I mentioned obesity, but yes, obesity is a significant risk factor. And the bigger you are, the higher your risk. And then the other thing about being obese is every medical intervention we have is more difficult in obese people. Open heart surgery is a lot more complicated in obese people than it is in regular people, non-obese people. Because you just imagine all the fat you've got to cut through first before you get to the ribs. And then you cut through the ribs, there's fat there again. And so you add an hour to the surgery just because you're obese. Same thing with angioplasty and stuff. It is more difficult to do an angioplasty on a fat person than it is on a slim person. So obesity is just generally not good. And then you get arthritis and all these things earlier. So it's easy to say don't be obese, but do your best. Just do your best not to be overweight. Do your best. It's not easy all the time, but it is small things, though. It's small things. It's like drinking soft drinks. It's like taking all this Ijakuja food at night, biscuits, chocolate, and all that we don't count as food. There are calories. There are a lot of calories. Nuts are said to be good, but most of us don't take a small pinch of nuts. We take a whole bottle or half a bottle of nuts, and then you wonder why you can't lose weight. So yes, obesity is a significant risk factor.
All right, Joanna, I hope that answers your questions. All right. Another question about salt. How do you measure the quantity of salt you take per day?
I don't know how to measure it.
And is it better to use sea salt for cooking? You know, there's all this pink salt, Himalayan salt, sea salt, you know.
Okay, that was easy. Any kind of salt is not good. All right. How to measure it, I really don't know. I just know bouillon cubes are salt. Sea salt, river salt, all kind of salt, all salts are bad. It's all sodium chloride. They're not good. There's even, I heard something, salted bread somewhere, but I know salt in there. I don't know how you measure it, but just know the places you get salt, those noodles, As the spices are salted, the cubes they put in there, they're salted. Granuts, cashew nuts, Chinese food, all salted. Fast food, all salted. But it is difficult to give you grams in Nigeria because we buy most of our food in the market. In the US and Co, everything is labeled. Then you can calculate. But us, it's a bit more difficult. A nutritionist might be able to give us that answer.
Okay, another question about salt. Do you have references to the study that came up with the 12-gram consumption that Nigerians apparently take on average? Or was it an estimate?
I don't have it right now. I can send it to you later. I can send it to you later. I don't have it on me now. But this is common knowledge.
All right, so the person who asked that question, I guess they can do a Google search or Google Scholar on that, and the paper might come up. But if we get the paper, we'll send it on. Okay, Ufi, do you want to unmute yourself and ask your question?
Okay, good evening, Dr. Good evening all, and thanks for the presentation. Okay, my question is straight and direct. For somebody that gets the symptoms of a stroke, maybe a tightening of the chest, headache, can the person just check his blood pressure, and if it's within range, maybe between the 120/80 calm, or still go to the clinic? Because sometimes we hear that even when the pressure is between 120/80, there's still a stroke coming in. Thank you.
Okay, that's actually a very good question. I haven't thought of it that way, but that is a very, very important question. Once you have signs of a stroke, your blood pressure is not the issue. You've got to get there, because if stroke is not always associated with blood pressure. In fact, most strokes are not associated with blood pressure. It's the hemorrhagic strokes that are associated with high blood pressure. So having a normal blood pressure doesn't mean it's not a stroke. No. You come in immediately. In fact, you shouldn't be wasting time taking your blood pressure. You should be finding your way to the hospital. And then we take the blood pressure for you in the hospital. But because it is interesting, when you're treating a stroke, and that's what causes some problems between the medical community and the patients, we tend not to crash your blood pressure down. We leave it there and bring it down gradually. So a lot of people complain that the doctor's not even treating my blood pressure, or the family complain that they're not even looking at the blood pressure. They're just letting it be 150, 160. The truth is, only if your blood pressure is above 200 will we bring it down a little bit. Because once you've had a stroke, you need some a higher amount of blood pressure to overcome the stroke and feed that damaged area with oxygen from the blood. So we don't bring it down. If you bring it down, you can make the stroke bigger. So that's why we don't bring it down as rapidly as most people would like it to be. Even for doctors, it's difficult for us to look at that blood pressure and not bring it down. Very difficult, but we all know if you bring it down too rapidly, you can make the stroke worse. So yes, you can have a stroke with normal blood pressure. A very big stroke will crash your blood pressure too. So blood pressure doesn't help you with the diagnosis.
All right, Ufi, I hope that answers your question. Okafor Ugochi, could you unmute yourself and ask your question?
Okay, good afternoon, sir.
Good afternoon.
So, I'm Okafor Ugochi, formerly Okeke. I worked with you in FCC. And my question is, I worked with you as a nurse, sir. But my question here is about the LDH. Some school of thoughts are trying to make us believe that this LDH is actually healthy, and that is not the actual cause of cholesterol, bad cholesterol, that instead it goes to those damaged vessels to aid healing. Then they also went further to encourage this carnivore dieting, which involves high intake of fatty foods and high protein dieting. I don't know how good this is, but that is what they are currently encouraging. And they went further to also say that the diabetes can be reversed if one can handle the dieting aspect, in the sense that you have to quit high carbohydrate intake and reverse to animal protein and as in everything high fats and protein dieting. So I don't know. The LDH is where I have a problem. Is it really good? Is it good as in like they preach it. I don't know. I'm a bit confused here about it.
Do you mean LDL?
Yes, LDH. LDL, okay. Sorry, sir. Yes.
Okay. I don't know those people talking about LDL is good. There's nothing good about LDL. Nothing good about it. Yes, some people can fix their diabetes by just exercise and avoiding carbohydrates. There's the Atkins diet and all those things that are high protein and all that. Those things are all controversial. The one thing I do know is LDL is just bad news. It's bad news. Know how you look at it. All scientific studies have shown that. There's some people, mischievous people out there promoting their own products and come up with these funny things. And by the way, just in case you hear that I've invented a drug that cures hypertension, it's not me, it's fake. So there are all these characters out there. But I can tell you that one without any equivocation, LDL is bad. It's bad.
Okay,
now,
sir.
okay.
Thank you, sir.
Now, there's something that people misrepresent a little bit, and that is cholesterol in the diet is not bad, all right? It is saturated fat. So yes, it is true. People misunderstand that cholesterol in the diet because it is not really cholesterol in the diet. It is saturated fat that gets converted to LDL. So cholesterol itself in the food is not bad. And maybe that's what they're trying to say. The cholesterol in the food, whether it's LDL, HDL, anything, doesn't get absorbed in your body the same way as saturated fat get absorbed and converted to the bad cholesterol.
Okay, so it's actually the saturated fats that they are saying is healthy. They said the unsaturated ones are not good. So, but in school, we're taught that the unsaturated ones are actually the healthy ones. So it's a controversy, and I don't know.
It's not much controversy. Those people are just saying their own.
Okay, sir.
So I beg to disagree with them.
Okay, sir. Thank you, sir. Okay, sir.
All right, thank you. Next question. Can not getting enough sleep and rest increase the chances of hypertension? That's one. And then there's been a few questions about red meat. That is, is it to avoid red meat altogether? Is chicken better than red meat? Is red meat, yeah. So those are the two questions. Sleep.
Okay. I can't see my picture any longer. You don't have to avoid red meat altogether. Just know the more meat you eat, the higher your chances of looking for trouble. But no, you don't have to avoid it altogether, especially people who are lucky. There's some people who are lucky, they don't have diabetes, they don't have high cholesterol, they don't have high blood pressure. So they have more leeway as far as eating meat. But no, eating meat is not a no-no. But the more meat you eat, the more trouble you're getting into. What was the other question? I can't remember.
Is not getting enough sleep and rest, can it increase the chances?
Oh, yes. Oh, it's a big deal. In fact, I'm sorry I didn't mention that. It is a big deal. Not enough sleep, obstructive sleep apnea, they're all contributors to high blood pressure, which puts you at risk for heart trouble. And the obstructive sleep apnea, which we call it, also directly damages the right side of the heart. So yes, not enough sleep will give you high blood pressure. It will put you at risk. It will make your diabetes even more difficult to control. So yes, you need to do your best to get sleep without taking sleeping pills, because that's another problem on its own.
Another problem entirely, yes. Okay, Sister Ajayi, could you unmute yourself and ask your question, please?
Thank you very much. Highly impressed by the webinar and for the on-time education that I have been privileged to get through Victory Drugs. May I say that during the course of this webinar, I have had some questions answered, but since I still had my name mentioned, I have to just drop this last bit of my question. Doctor, I am scared by the term. While I enjoy all the education, the expose regarding how it could form, should cause it, and things like that, I am scared, especially when over time I used to be a 120 regular person, 120/80 regular person. And it was amazing, even to medical personnel, that at my age, then I was below 70, that at my age, I was like a 16-year-old kind of BP. But suddenly, after 70, I became 130, 85, 90. And before you know it, I will feel the surge within me that something is going wrong. And by the time I check, actually, it's really wrong. It could be so wrong, sometime 150 plus. It could be so wrong at a stage, it was 170 plus. I had to rush to the hospital. And I recall I was given Stugeron at a point whenever it went up that way. However, I want to just find out, when a person has this irregular blood pressure, not regularly, irregular in the sense that it will come within 3 months, it will come any other time, but it is irregular that whenever it comes, it could take a week before it can pipe down. The person is becoming susceptible to heart attack or what? Please allay my fears so that I can enjoy this lecture to the fullest. Thank you very much.
Okay, I don't know if it's just okay. I'm sorry, but
there was interference.
while you were speaking, yes, there was a lot of interference, so I didn't get all what you said. But I think you asked if, I think I understood that your blood pressure fluctuates, that before 70, you had perfect blood pressure. After 70, you started having these issues with fluctuating blood pressure, even going up as high as 170. It is not unusual. The older you get, the higher your chances of getting blood pressure. So that is not totally unusual. And when you have fluctuating blood pressure like that, oftentimes there's an external factor responsible. And the most common one I've found is this salt intake. You don't realize you've eaten a meal with a lot of salt. And the older you are, your arteries are a little bit more brittle and stiff. So they respond to things like salt. So you need to check and look carefully. Have you been taking anything that might have salt in it? Things like that. A blood pressure going up to 170 and coming back down doesn't really put you at risk, because when you exercise, your blood pressure does go up to 180, almost 200 sometimes. So as long as it comes back down, you're fine. It is sustained elevated blood pressure that causes trouble. That's what causes trouble. But now, if your blood pressure spikes to 240, that's a different problem that you need to bring down quickly before it ruptures something. But generally 170 and it comes back down, it's usually fine. But I wouldn't worry too much. It looks like your pressure is fine most of the time. And then some part of it could be anxiety, lack of sleep, and things like that. But usually there's an external factor. Sometimes it's internal, like a disease called pheochromocytoma, but that requires some extensive testing to find out. But as long as the blood pressure is fine most of the time, it's usually okay.
All right, thank you for that. Now we have a question about palpitations. Someone wanted you to define that, what palpitations are, and can anything be done to stop palpitations?
Palpitations. Palpitations, by definition, just means awareness of your heartbeat. That is the definition. You can feel your heartbeat. Now, it could be normal, it could be abnormal. When you're tense, you're anxious, you're running, you're waiting for exam results, and most of you look too old, you're waiting for exam results. But things like that, arm robber has a gun in front of you, those kind of things, you will feel your heart racing. That's palpitation, that's normal. Now, sometimes palpitations reflect something abnormal in the heart rhythm. And then there are many things that can cause it. There's things like atrial fibrillation, what we call SVT, just your heart racing or your heart going too slow can give you palpitations. So it all depends on the cause of palpitations. So there's no one answer to how do you treat palpitations or what do you do to make them go. Anxiety is the commonest cause of palpitations I've seen. Then then comes the rhythm disturbances and things. If you take too much caffeine, you will get palpitations and things like that. So it all depends. There's so many causes of palpitations, just difficult for me to tell you how do you fix them. No, it depends on what the cause is. You treat the cause.
Thank you. Treat the cause.
Palpitations associated with fainting, passing out, very important. Get yourself to hospital immediately, because that might be a serious rhythm disturbance that could cause trouble that needs to be treated.
Okay. Thank you. I'll just go to Emmy Aaron, because I think you were trying to ask a question earlier and you dropped off. Dr. Salis, I'll come back to you. Emmy Aaron, do you want to unmute yourself?
Okay. Good evening, doctor. Thank you very much. Can you hear me?
Yes.
Loud and clear.
Okay. Thank you very much, sir, for this opportunity, and also for the great informations that you've been able to pass across to every one of us on this platform. Thank you very much, sir. Not very often do we get doctors explain things like this, right? Okay, so my question is, I'm 39 years old, and I was diagnosed with TIA in May, right? So before that time, I was having numbness on the left side of my leg. You know, I thought it was traffic stress, being in traffic for, you know, how Lagos traffic can be and all that. But it got worse that I couldn't move properly with the left leg. You know, so I think towards the end of May, I had a fall and I was rushed into the hospital. And after that, I think I recovered from that unconscious state after some hours. And I was given some drugs and I was discharged. But since then, I have been having difficulties with using the left side of my body. You know, I've been undergoing physiotherapy since that time. And 2 weeks ago, I noticed I was having some form of tremor on my left arm. And I spoke to my doctor. So he said I should reduce my, what they call it, exercise time. And let's watch it for the next 2 weeks and see if I will still be having the tremor. So I'm a little bit worried about that. And when I saw the link for the meeting platform today, I said, okay, let me join. So if I can have an opportunity to have these questions or fears cleared out for me.
Okay, a bit difficult to sort things out like this.
Sorry, my physiotherapist said it was exhaustion that was causing the tremor. It's like more muscle movements that I was having.
Yeah, the muscle movements are one thing. It could be seizure, it could be many things, but I agree that it could be exhaustion. But I'm not sure it was a TIA you had. It looks like you actually had a stroke.
Okay.
TIA is transient. There's no permanent damage. So sounds like you had a stroke, but difficult to say without seeing you, without seeing the CT scan and all that. But I agree. If the tremors don't come back, then it looks like it was exercise induced. But the physio is still important to carry out, still very important. And if there's any doubt, then have a neurologist see you, and just to be sure about everything. But just from what you say,
May, sorry, sir. In May, I saw a neurologist, and I was advised to do some tests. I had a 2D echocardiography done. It was good. I had a D-dimer done. It was good. I had ECG done. It was good. And also lipid profile. My cholesterol was a little bit 0.3 high. That was the only result that had a little bit of abnormality. And I also had a CT scan done, which was good.
Okay. So, well, difficult for me to offer advice without, because your situation is not a quick answer. One has to go into detail with it. I can't give you many answers over the phone right now.
Okay,
Yeah,
sir.
so I suggest, maybe you get in contact with Dr. Johnson offline, please. Dr. Johnson
Okay, how can I do that?
He'll put his whichever contact details he wants people to contact him on in the chat.
Oh, okay, thank you
Dr.
very
Johnson,
much.
is that okay?
Mm-hmm.
All right, next person.
Thank you very much, sir. Thank you very much, ma'am.
Sure.
No problem.
Please
Dr.
chat me
Salisu.
out.
Yes, thank you. I'm back again. I just want to make contribution this time around. I forgot to mention that I worked on myocardial infarction during my PhD. That was actually my thesis. And I worked on vegetables. That is just by the way, not the regular vegetables. And I must say categorically that just as much as doctor has mentioned vegetables and then we always just don't take it seriously, they actually prevented the myocardial infarction that induced in both male and female rats, And I can categorically say that vegetables, like doctor said, are very, very key to prevention of heart attack. I mean, based on my own findings and other heart diseases. And I've also read in the literature that walnuts, like doctor, I don't know, he categorically said not, but walnuts has been proved to be very, very good for cardiovascular diseases, heart diseases. There are a lot of recent studies, even the clinical trial by September 2021, about 2 years ago that I read, and another one came out recently, that walnut is very good for heart. I don't know doctor's opinion about that, but I mean, we that we are scientists that we carry out research and how we're always abreast of what is happening with the update of cardiovascular disease and the rest. So I just want to chip in that of vegetables, and I didn't work on walnuts, but I mean, it's in the literature, the findings have shown that I worked on vegetables and not the regular vegetables, our own local vegetables. So I realized in whichever part of the country we might be, we have our own seasonal and local vegetables that are supposed to be consumed to prevent heart attack or cardiovascular diseases before we start taking intervention. I mean, talking about that we can abstain the pop-off and the rest, I just want to add that because it's actually preventable. That's just my contribution. Thank you.
Yes, ma'am, I align with everything you say.
Thank you, Dr. Salisu. Vivian, could you unmute yourself and ask a question, please?
Good afternoon, everyone. Good afternoon, Dr. Adeyemi. Thank you for this very insightful presentation. My question borders around low blood pressure and very high cholesterol happening at the same time within a system. I constantly, regularly find my blood pressure is always below 100. Figures like 84/65 are the kind of figures I can get, as low as 96/maybe 66. So I'm wondering, in the midst of that, I have high cholesterol as high as 245 or 255 or sometimes 299. I'm wondering, in this very scenario, do you have, I don't know if you would be able to explain what I'm meant to do, because I actually go on very high amount of salt. I go for healthy salt like sea salt to see if my BP results could go higher, but rarely does it jump up. So I'm wondering if there's something that I can do, because in this situation, we're talking about very low blood pressure. I don't know if I can call this very low, but I feel fine. I feel okay, except that my cholesterol figures are sometimes high, but HDL is usually very okay, above 55, above 60. LDL about 170, or 160 or 130 sometimes, because I'm someone who goes checking my figures from time to time. So I'm wondering, what can I do in this situation? Do I worry about the low blood pressure? What really would you advise me to do? Thank you.
Okay. No, I wouldn't worry about your low blood pressure at all. That blood pressure is normal for you. Just be grateful that is your problem. You don't have to be taking salt to get it up. Don't look at the numbers. If your blood pressure is in the 80s and you feel fine, that blood pressure is perfect for you. Yeah, so blood pressure is not one of your problems at all. So be grateful for that blood pressure. Most of us will be very happy to have that kind of blood pressure. And now, if you are hypertensive, always 140, 150, and your pressure drops to 85, you will feel it. That's not normal for that person, but for you, that is normal blood pressure. So don't worry about it. No need to start taking salts and all that stuff. That blood pressure is perfect for you. Now, the other question about cholesterol, your cholesterol is too high. That's just the bottom line. I don't know how old you are, but your cholesterol is too high. And most people would put you on a cholesterol lowering diet first. And then if that doesn't work with exercise and all those good things, if that doesn't work, then you might have to be on a drug to bring it down. It's a bit too high.
I'm actually 48. And sometimes I feel this, low perfusion of blood in my extremities, especially my right hand. So I think that explains the low blood pressure, but I don't know what I could do to increase perfusion.
No. That feeling in your arm is usually not perfusion, usually the nerve endings coming from your neck and things like that. It's not from your blood pressure. So yes, it feels like there's not enough blood, and then all of a sudden blood starts rushing to the fingers. It's the nerves being compressed from the neck, usually. And that the most common cause of that is what's up. On your phone, your neck is bent and your neck is not upright the way it should be. So it's a posture problem most of the time. If your blood pressure is low, it's not going to choose one arm or the other. It will make you dizzy, lightheaded if it's too low for you. Not cause trouble with one arm or the other. That trouble with one arm or the other is almost always a nerve problem, usually from the neck. So yes, the only issue I have with what you've told me is your cholesterol is high, and you need to work on that. Since you don't have other risk factors, I would start first with aggressive lifestyle changes and see if that works. If that doesn't work, then you might need a drug.
All right, thank you. Another question from the chat: does menopause increase your risk of heart disease?
Yes.
And if so, what can one do to mitigate this risk?
Grow younger. Yes. What happens is menopause, once you get to menopause, your estrogen levels are lower. Estrogens somehow are protective. So once you get to menopause, your estrogen level is lower. HRT drugs actually help with that, but then they have their own problems. So generally, HRT drugs are not recommended unless you have significant symptoms. So what you do to mitigate your risk is what the rest of us do who don't have the opportunity of getting to menopause, which is control your blood pressure, control the traditional risk factors, eat healthy, look at your numbers, see what your cholesterol is. If you have diabetes, monitor it properly, do all that sort of thing. So it's basically the same thing everybody else does. It does not mean when you have menopause, you're going to get heart disease, no. But in general, you just need to double up on looking after yourself and living healthy.
All right, Abiola, please unmute yourself and ask your question.
Okay, yeah. Thank you, Dr. Johnson. Please, my question is that what counsel will you give for the elderly when they have isolated systolic hypertension? The systolic pressure is still maybe within the range 140 and the diastolic is going low 70, 60. Do you counsel? We have read, we have heard sometimes that we should not be so concerned about dropping the pressure in the elderly. To what extent can one go when we have elders maybe in their 70s, 80s? Thank you.
That's a great question. It's something we deal with all the time in cardiology. As you grow older, your arteries get a bit stiffer. And that's why there's a big difference between the top number and the bottom number. It's called the wide pulse pressure. First thing is to make sure that what's causing it, as opposed to one of your valves leaking. One of the valves can cause that if it's leaking, aortic valve. But in general, if you're elderly, depending on your definition of elderly, if it's around 140 and the bottom part is 60, I don't try and treat it because you find that those people tend not to tolerate blood pressures of 120, just tend not to tolerate it. So you just got to stay a little bit higher and maintain the circulation in the brain. So yes, 140, I wouldn't stress. If it's 140 over 60 and all that, I wouldn't stress about it, no. Because when we try and treat, everything comes down and the patient feels very uncomfortable. So we bring it down to as low as you feel comfortable. When you start to get dizzy or lightheaded, it's too low and it defeats the purpose.
All right, Abiola, I hope that answers your question. Okay, so we have one in the chat. You've touched on it earlier about eggs and cholesterol. Maybe the person joined late, but they've said there is a controversy about cholesterol in eggs, snails, and seafood generally. And one school of thought says, no worries, others differ. What are your thoughts on this, just for those who may have joined late?
No, there's no controversy unless you're still reading the old literature. The new data shows that cholesterol in food does not translate to high cholesterol and high LDL in your blood. It's a saturated fat. So yes, we used to say don't eat eggs, don't eat egg yolk, don't eat lobster, shellfish, snails, but no, it is fine. It's not, I mean, of course, if you eat too many eggs, anything in excess is always a problem, but in general, no, it's not a problem any longer. About 20, 30 years ago, we thought it was a problem, but now the research shows that it isn't. The longer we live, the more science comes up with different things that might change what we thought was right, many years ago. Yeah.
Yeah. All right. So what's the next question? Okay, we have a question about dizziness. What is the cause of dizziness when one stands up after sitting down for a while? Is it low or high blood pressure?
It depends. There are many reasons. First of all, you shouldn't get dizzy in general when you stand up. All right. But sometimes as you grow older, these same stiff arteries can be the problem. And you need to, most older people will know that just don't get out of bed like that because you take your time. If not, you might get dizzy. Usually the cause is low blood pressure or relatively low blood pressure. Your pressure is supposed to go up when you stand. But having said that, there are so many different things that can cause dizziness when you get up, including vertigo and things like that. So difficult to just give a general answer, but usually if you get up and you get dizzy, usually your blood pressure has dropped a little bit.
Okay. Now someone's asking about vaccines. Are there any vaccines one can take to protect the heart?
None that I'm aware of.
Okay. If you have any questions, do raise your hand. We're coming to the end. People are asking for your contact, but I've just posted that. Let me see. Techno, come on. I think you need to raise your hand to ask this question because your question is not clear. If you're still online, you're talking about hole in the heart, but your question is not clear. So if you can raise your hand, and then you can ask the question, and then we can answer that hopefully for you. Okay, now back to salt again. What brand of salt can be referred to as safe?
None. No, all salt is not good. I mean, you need salt. I'm not saying you should not take salt at all, but any salt is salt. So there's no brand that I know. All salt is salt.
That's it. Okay. So everybody, salt is salt, which is what I just said. Salt is salt.
Salt is salt.
Yeah. What can cause one side of the heart to be bigger than the other? What can be done to correct it?
Okay. In simple terms, there's two sides of the heart, right and left. the right side of the heart pumps blood to the lungs. So anything in the lungs that causes difficulty for the heart to pump, like what we call pulmonary hypertension, blood clots in the lung, can make the right side of the heart bigger. But it's not a straightforward thing like that. Valves, if your valves on the right side are leaking, like tricuspid regurgitation, that can cause the right side to be bigger. On the left side, it's most usually hypertension or outflow obstruction to the blood in the left side of the heart, which is the left ventricle, which would be like aortic stenosis. But it's not just straightforward, simple like that. Most of the time, both sides of the heart get enlarged together. But you can have one side being more enlarged than the other side. But that is a whole 1 hour discussion.
Yeah. Okay. Techno, come on. Do you want to unmute yourself? And then ask your questions.
Okay. Good afternoon, doctor.
Good afternoon.
Yes. Concerning my question about the hole in the heart, like is a hole in the heart for the palpitations, and then for palpitations that usually starts when one has hole in the heart, like what does one need to do?
That's a bit of a confusing question. Now, a hole in the heart, it all depends on where the hole is and how big it is. If the hole is significant, then it might need to be fixed. Sometimes it's too late to be fixed. It all depends. But hole in the heart, there are many places the hole can be, and depends on the size and depends on the age of the person and things like that. So generally, when a hole in the heart is causing trouble, we tend to fix them, either by surgery or percutaneously. But
okay,
it all
yes.
depends.
Yes, I'm actually 25 and I've done surgery before, twice. But I'm still on medication because palpitation starts, sometimes it just starts up out of nowhere. So my question is like, what do I need to do when it starts up, or even before it starts up? How do I need to go about it?
Okay, now I understand. Well, first, we need to find out what exactly is causing the palpitations. What kind of rhythm problem? Is it ventricular from the bottom part of the heart? Is it atrial from the top part? Is it from what we call the AV node? So while you're having your palpitations, we need to record what is going on in your heart. And then that way, the appropriate treatment can be given. So it all depends on what is causing the palpitation. I cannot tell you that over the phone. You need to see what tests you've had done and things like that, and see if there are things that can be treated either with medications or another procedure. So difficult to say, but the cause of the palpitations has to be clearly defined before treatment can be discussed.
Okay. Okay, thank you.
Sure.
All right, Raduche, unmute yourself.
Okay, yeah, good evening. Can you hear me all? Good evening all.
Yes.
Okay, good evening,
yes.
Doc. Yeah, okay, my name is Raduche Okoma. I am a radiographer actually. So, Doc, I'm very happy to have, come to interact with you at this point because I've heard so much about you. When my sister was working with you in Lagos before she traveled out, we thank God for all that you have been doing. Then, sir, I want to know, we have this history. My mom is hypertensive, my dad is too. And though ourselves, we've not really had any issue, like maybe a heart issue, but I know sometimes these things can be in the family, can run in the family. So how often, sir, are we supposed to like be doing our checks? Like if I'm to say, can I maybe check my BP, go for any heart, maybe 2D echo or stuff like that? How often am I supposed to, be doing that, sir?
I would say if your blood pressure is normal now, there's no hard and fast rule. If you have family history, father, mother, there's a greater than 30%, 40% chance you are going to get hypertension yourself. So I would check, if you get a blood pressure cuff at home,
okay,
and just check it every now and then. There's no hard and fast rule. I would not wait more than a month. Just check it. all right,
Okay.
and see how it is. I would say once a year, twice a year. No, the easiest thing is get a blood pressure machine at home and check it every now and then. Yes,
Okay.
but I
Okay,
would check it at least once a month if I was in your shoes.
Okay, sir. Thank you very much, sir.
Sure.
Okay, Olushaye, you have a question. Could you unmute yourself and ask, please? Olushaye, I've asked you to unmute. All right, okay, we go to Joshua. Want to unmute yourself?
Okay, good evening all. Doc, thank you for all the information you've been sharing. I'm getting a lot of knowledge here. Okay, my question is this. About 2 years ago, I had a test done for glycolated hemoglobin and it was 6.5. And then after then, I would advise to be taking glimepiride once daily and also take care of my diet very well. So I was doing that for more than a year, and after some times, I noticed that my sugar level was coming down so much that I would become very dizzy and even feel very sick. So each time I feel that way, I just run the test, fasting blood sugar or random blood sugar, and I discover that it is low. And so I stopped taking the glimepiride and I started living my normal life. I don't know if that is okay. Though my dad died of diabetes complication, and also my maternal grandmother died same way too. So what advice do I have?
Okay, that's not difficult. Once they put you on drugs, they should have taught you how to take your blood sugar, how to measure your blood sugar. So you, if the most common cause of your sugar going down too low is you've started eating healthy and exercising and losing weight, which is good. And then you might not need the drugs anymore. So you need to check your hemoglobin A1C again and check your finger stick glucose regularly. And you'll find out whether you check your finger stick glucose first thing in the morning, fasting, and then check it 2 hours after you've eaten and see where your glucose is. If it's within normal range, it means you have fixed you're controlling your diabetes with diet and exercise and good habits, which is always preferable to medications if you can avoid them.
Okay, thank you, sir.
All right, thank you. Question about gallbladder stones. Can that increase the risk of heart diseases and can it be treated?
Well, I'm not an expert on gallbladder stones. Generally, what I know is we don't fix gallbladder stones unless they are causing trouble. If you just see them incidentally, we leave them alone.
Okay.
Fixing is usually surgical. So, but I do not know of any associated risk with gallbladder stones and the heart.
All right.
Excuse me.
All right. So I'm going to take the last 2 questions. So this is last chance for questions. Dr. Johnson needs some water now. Christy Ferdinand, do you want to unmute yourself?
Thank you very much for this opportunity. Doctor, we appreciate your lecture. I just have this question. My mom has been on antihypertensive for like not less than 13 years. She's 82. And, you know, several times I was thinking she'll be asked to stop her drugs. She's also on simvastatin for cholesterol. So several times I've sent her to the doctor, and the doctor will either review the drugs and still tell her to continue the drugs. Sometimes her pulse rate gets as low as 55. She was at a time on propranolol. So I don't know the advice, doc, that I can get, because I think that by now at this age, she should be asked to stop some of those drugs. She's on lisinopril, amlodipine, and she takes them like religiously.
Okay, nice question. That's a frequent question I get in the clinic. Unfortunately, when you stop taking your blood pressure medications, your blood pressure tends to go up. So the blood pressure medicines don't cure hypertension. You've got to keep taking them until you get to the point where you are willing to take a risk of getting a stroke. But in general, the older you get, you tend to take more medications, unfortunately. And yes, it'd be nice to take them off the medications, but you've got to remember those medications are probably keeping her healthy and alive without a stroke and all those things. So yes, I wouldn't stop. My mother is 88. She's on those same drugs you mentioned just now. And I don't think we will stop them unless all of a sudden, because as you grow older, sometimes you get really skinny and then your blood pressure comes down, you don't need the drugs. But generally speaking, we don't stop the drugs because you're old. No, we tend to keep them in check so that you continue to stay healthy and try and live as long as it's possible. That we know how to do. 55 is not too slow. Generally, it's not too slow. I know everybody has 60 in their mind. No. For cardiologists, it's below 50, we start to look at why your heart rate is slow. And many times it's the blood pressure medications that bring it down that low. As long as you're not dizzy and all that, we will tolerate it.
All right. Thank you. Okay, so last question. Olusheye, do you want to unmute yourself?
Yeah. Thank you very much. Thank you for the good lecture. I am 61 plus. At the beginning of this year, my BP always between 140 to 150 over 100, 105 at time 90 to 100. Later, I went to see a cardiologist. About 2 weeks ago, I was placed on amlodipine 5 milligram. But I discovered that the BP dropped to in the morning to about 110, 120, and the evening to about 105, 70 something. So I always feel dizzy now throughout the day. I don't know what to do. I was advised to take alternative day, still getting dizzy, even in the morning. I don't know, what do I do?
Okay, usually that just requires adjustment of your drugs. Maybe that 5 milligrams is too strong for you. Maybe you've also started watching your diet and things like that. So there's one thing about blood pressure. If you are obese, if you take a lot of salt and you don't exercise, and you start to do all those things, reduce your salt, start to exercise, lose weight, your blood pressure can come down. So it is very possible when your blood pressure comes down like that, and with the drugs, it comes down too low. So your blood pressure at 100 is making you dizzy, then it's too low for you. So it needs to come back a little bit higher than 100. So it depends. That's the question you and your doctor need to sort out because you have a relationship. But generally, if just off the cuff, I would reduce that drug to 2.5 and then look at all the other things and see what else is going on. Have you reduced your salt? Have you started to exercise? Are you eating healthy? And that might be why. And then you might be lucky to be one of those people that can come off the blood pressure medicines. So it all depends.
Thank you very much, sir. Thank you.
All right, I know I said last question, but there's one more. Bode, do you want to unmute yourself?
Thank you. This has been very positive and it's a very value add. My question is, there are different antihypertensive drugs that contraindicate each other, sometimes some of these, and eventually creating some other health issues. From the professional point of view, how do you address the issue of polypharmacy?
Is that the end? It sounded like he cut off.
Yeah, how do you address the issue of polypharmacy, multiple drug effects,
Okay, all
interacting with each other? Thank you.
Actually, it can become a difficult situation. And what makes it more complicated is when patients see different doctors, and those different doctors are not in communication with each other. And so you don't know he's taking one drug, then you add another drug, and then you find complications or problems with the drugs. And then, so what I tell the patients to do, please just bring all your drugs. Just bring all. Bring them in a wheelbarrow, whatever. Just bring all so we can see what they are. And it's quite interesting to see how many times they're taking drugs that are similar, just different names, causing issues like that. Yes. So I think it's important for the doctors to be aware that the patient might be taking other drugs, might be taking herbal drugs on the side that they don't count as drugs. Find out that things like turmeric actually thin your blood, then you wonder why they're bleeding when you add aspirin and things like that. So yes, polypharmacy is a concern. And many times there's so many different drugs, you actually have to go and check on a drug encyclopedia to tell you, you put the drugs with each other, because no doctor can know all the drug interactions any longer. There's so many. So you have to check, you have to be diligent and check to see if they interact, and then decide how you adjust your drugs accordingly. But yes, it can be a problem. It has happened many times. And then sometimes I even have to admit the patient to just monitor what drugs they're getting. Because some people just go to different doctors. They call somebody on the phone, usually from the US. They call the family in the US. I want to say, okay, take this drug. They add it to their drugs, thinking the local doctor doesn't know anything. And then they're finding out that, just utter confusion. So yes, both patient and doctor have got to be careful.
I mean, better still, see your pharmacist. That's why you have a pharmacist. And
they go to different pharmacists now.
Well, you should
Same way they go
at
to
least
different doctors.
yeah. But I mean, if you have a regular pharmacist that you go to and a regular doctor, so don't be.
Then that will be sorted out. Yes, exactly.
Exactly. So hopping
many
around.
times the pharmacist that tells the patient, tell your doctor this, this, and this, and then we check and then find out, okay, we've got to change. Yes, it's important.
Yes, Dr. Johnson, make sure you like pharmacists. Work with the pharmacist. Yes. Right. Okay, I was about to say no more questions, but someone's just put in the chat, does apple cider vinegar lower cholesterol? Yeah.
I heard someone say here.
It was me.
I don't know. I've heard that it does, but I truly do not know. I have to go and check that. And for those type of things that are not strictly speaking medical, or go to webmd.com and you type in apple cider vinegar, it will tell you what data there is on it. So I really don't know. I'm going to check, because I was reading something recently about good benefits of apple cider vinegar. So I will go and check myself, but go to webmd.com. It will give you what research has been done, and it's a good source. So yes, I don't know the answer to that, but I will go and check it myself.
All right.
I'm not one of those doctors that is against natural remedies. No, I'm actually in support of them. So yes, I will go and check it myself. Yeah, but I do know there's some natural remedies for blood pressure that have worked. Oh Lord, I remember the name of the leaf that they used to make, moringa. I found out that moringa actually does lower blood pressure, and I have quite a few patients whose blood pressure was not too high. They were able to come off their drugs by taking moringa tea. Now I do not know the dosage and all that stuff, but generally moringa tea does help to bring down blood pressure.
That's the question I was going to ask. What's the dosage? How much tea do you need to drink, and so on? But before you do that, please take advice from your doctor or pharmacist, please, before you start drinking barrels of moringa tea.
I won't take more than a teacup twice a day.
I had to put that disclaimer in, because the next day they said we should drink moringa tea. So
yes, yes.
All right. Does any green vegetables have adverse effects on warfarin?
Many, almost all. Because what warfarin does is it works against vitamin K factors, vitamin K dependent factors, and lowers those levels. And most green vegetables have vitamin K. So they actually antagonize. So many people, we give them warfarin. There are two different types of doctors as far as this is concerned. Some tell them don't take vegetables, green vegetables. I tell them take your green vegetables, but make it a consistent amount. So we adjust your warfarin according to how much vegetables you eat. But yes, green vegetables, vitamin C will bring your INR down when you take warfarin.
All right. Dr. Salisu said she worked on moringa, so I want her to just add a comment about that. Dr. Salisu, can you unmute yourself, please?
Yes, yes. I worked on moringa oleifera, the seed, the root, the stem, and it's amazing that the dried part even work better than the fresh. So, and I'm talking about the dosages, just to chip in, like you said. It's
You're not very
what I
clear.
need to know now.
Dr.
Hello?
Salisu.
Can you hear me now?
Yeah, that's better.
Okay, let me move it from there. All right, so talking about moringa oleifera, I also worked on that during my course of study. I think that was my MSc. I worked on all the parts, and just to add to the moringa is fine. Just a tea bag a day. I mean, once in a week, once in a month, and it's just all about the kind of diet one is into. You know, that is by the body dosages in particular has to do with the body weight, like the doctor said. And presently, what I'm working on in the molecular toxicology is that once people hear about any medicinal plant or vegetable, they just go like, once it works for something, it works for all. It is very, very wrong. And we are beginning to restructure back, using this molecular approach, like actually come up with dosages for these natural plants that have worked, that have proved positive for many of the diseases we are facing in this part of the world, especially African countries. So we were able to work on based on we have to check the body weight, just like we use for the rat. And there's a particular calculation formula we came up with to work on the amount of moringa to take per body weight and per the amount of particular diet, which all the normal classes of food have to be in place. So is it not just a one-way thing like go take a cup, take one or two? But however, if one doesn't get that, it has to be taken by the industry, pharmacy staff to come. It's not just a scientist thing, and hopefully we get there in Nigeria. But at least a little bit of what they say is good. It's fine, not just overuse, based on our diet.
Did you publish your research, Dr. Salisu?
Yes, I did. And one just came out, I think, was it? There's another one that just came out yesterday, the moringa and the other spices that we actually tested in cement factory. I think that one was just published yesterday. It's out.
Okay, can you post the links to the papers in the chat for us, please?
Yes, I will do that now, the last one. So it's fine. Moringa is fine. I will post the one that just came out yesterday. I'll post it now.
Thank you. Right. Any more questions or comments? Please raise your hand. If not, I want to leave the last word to Dr. Johnson. What is the take-home message you want everyone to take home today, even if they've forgotten everything else, even though there's a recording? What is the take-home message?
Well, to me, most heart attacks, strokes, and cardiac arrests can be prevented. Majority can, not all, but majority can. And it's simple things. It is simple things. Watch your blood pressure, know your cholesterol level, eat healthy, exercise. Those things will go a long way. And don't do crazy things like smoke. I've looked at all the people on this Zoom meeting. I don't think anybody here smokes. So I think we're all good there. But please, smoking is a no-no. And that's basically it. And when you have the signs, chest pain, signs of a stroke, get to a hospital and scout your hospitals. Know the hospital you're going to go to in case of an emergency. I know many people will say, I'm not going to have an emergency, I forbid that. But just check in case somebody around you is having an emergency and you have to help. Find out the hospitals that you will go to so that, we don't have a robust ambulance system right now. So you're going to have to find your way to the hospital. So just find out which hospital you're going to go to for an emergency, and you will help yourself.
Thank you so much. Before we go, a quick word from John. John, are you ready? Dr. Salisu has
Yes,
posted
I'm
the link.
ready, Flora. Can you hear me?
Yes, we can. Go ahead.
Can you hear me, everyone? Okay. Good evening, everyone. My name is Ahiri Sangbedo, and I'm the project manager for Gintavenes Health Foundation. So we're delighted that you've been able to join us for this knowledge sharing session and have stayed to the end. But before we go, as is customary for us, we'd like to let you know a little bit more about us and how you can support the cause. So Gintavenes Health Foundation is a non-profit set up in 2018 to conduct humanitarian interventions in the healthcare sector in Nigeria. Interventions take many forms, but mostly they're in-person physical interventions with healthcare professionals and patients as well. But sometimes they also take this form of the virtual, such as this webinar. Now, whatever the form that they take, all of these things are made possible by charitable donations made by corporate organizations and well-meaning individuals as well, such as people like yourselves who are calling from all over the world. And it's in light of this, or in the spirit of this, that we ask you to consider making a donation to our official account. So it's a Stanbic IBTC bank account. The account details are 0028901410. I've placed something. Let me see if I can share my screen. It's supposed to be here. Don't see it for some reason. Okay, here. So can everyone see the screen? Can we see my screen?
Yes.
Hello, Flora. Okay. So as I said, our official account is a Stanbic IBTC bank account. It's Gintavenes Health Foundation. The account number is 0028901410. So on that note, I'd like to say a very big thank you on behalf of the Board of Trustees, the entire Board of Trustees of Gintavenes Health Foundation, our sponsors, our partners, and our perennial collaborators, as well as a big thank you to our facilitators, pool of facilitators that make interventions of this sort and other sorts possible. So we'd like to also say a very big thank you to Dr. Johnson for giving us the benefit of his time, his expertise, and his experience. And it was a very rich package, and I'm sure most of us learned. It was very, very interactive, and most of us learned. I'm sure most of us learned a lot of things that will help save lives, if not just for us, but people in our wider circle as well. In the event that you may have missed anything that Dr. Johnson covered in his speech or in his wonderful presentation, you have the opportunity of going onto our YouTube channel to viewing back. You can watch back everything that's been recorded today, because this session was recorded, as we were notified at the beginning of the session. So you can go on there and watch either this session back or any of our other catalog of content, the previous health talks that we've had, particularly the ones that are also related to the topics that Dr. Johnson covered today. So on that note, I'd like to say a very big thank you to you for joining us from wherever you're joining us from. It was great to have you.
Okay, I think the network has got cut off. All right, everyone. Have a great weekend. If you'd like a copy of the slides, or I've posted the YouTube link in the chat, and Dr. Salisu's link to her paper, if you're interested in reading about the moringa and its effects on blood pressure. She's just sent me another one. I'm just posting that. Thank you so much for attending. Please do share the recording with people in your wider circle so we can all be informed and enlightened. Have a great weekend, and God bless you. Good night.